In one of the Northern Territory's most remote communities, indigenous residents are accusing the region's Aboriginal Health Service of failing to respond to emergencies on a regular basis. They're alleging it's contributed to at least one premature death and damaged long-term health outcomes for other patients. But the Sunrise Health Service says it's struggling to recruit enough staff.
In the remote community of Ngukurr, 4 hours' drive to the nearest hospital, Priscilla Dixon took her niece Shanara to the community clinic with abdominal pain.
She was told to take some painkillers for the pain and told she was maybe just the cause of it maybe was just from her tight clothing.
Shanara says when the pain became unbearable 2 weeks later, she was airlifted to Darwin Hospital. Her appendix burst on the way.
I couldn't walk, stand on my feet. It was really painful.
She says it became infected, and 2 years on, she's still suffering regular pain.
I felt very upset at them when it turned out that it was the appendix, ruptured appendix. She was very sick.
So this is your clinic in Ngukurr?
This is the clinic.
In the neighbouring community of Ngukurr, where the health clinic is only open 1 day a week, residents also depend on the Ngukurr clinic.
When we ring up for someone, oh, we haven't got a driver, there's no one here to operate a vehicle, or there's no one here to see us. Recently it was shut because of fatigue. Well, you know, we can't work around fatigue.
Ngukurr resident Annie Daniels says her terminally ill nephew, Mr. Crew, died in August after the Ngukurr clinic was unable to send help when he couldn't breathe.
Like, we knew that he was, the doctor said that he was dying, but a little bit of help would have helped him stay longer.
When we had sick kids here, they've been panadol. That's all they ever talk about, panadol. And they ask you questions, and the question they ask, it's belong to them. I mean, we're not a doctor, we don't know what's wrong with that person.
The Ngukurr clinic and all the region's other indigenous health centres are run by the Sunrise Health Service. Sunrise Health wouldn't comment on individual cases, but said 13% of its services are provided after hours. These are triaged, and all serious presentations are treated as well as possible. It also said miscommunication in reporting emergencies appears to have caused tensions, and it's developing better intercultural staff training. This isn't the first time the treatment at the clinic here has been under scrutiny. In 2014, the Northern Territory coroner found that a 24-year-old Ngukurr man, Mr. Daniels, died of a heart attack because the clinic staff mistook his symptoms as dehydration. They didn't test his blood pressure, monitor his heart, or call a doctor to get further advice.
I felt they wasn't doing their job according to their, responsibilities.
Sunrise Health says since the inquest, it's employed a new clinical educator, increased clinical oversight, developed a new after-hours procedure, and passed official accreditation processes.
This death happened now is still the same since from the coroner's report there.
Bobby Nungamajba took the community's anger about Mr. Crew's death and a string of other complaints to a meeting with Sunrise Health last month.
Because a lot of our community now are thinking differently now. They're talking about the health department taking over our clinic now.
The Territory government isn't considering that.
We believe that Aboriginal people are best in charge of their healthcare, making the decisions, and that's why we're working with them to strengthen those services.
Sunrise Health says recruiting, retaining and accommodating nurses and drivers is one of the biggest challenges, and it's developing new fly-in, fly-out recruitment plans. But it says inadequate federal funding forces it to ration resources.
It's about us advocating strongly to get the required amount of resourcing that's required to deliver services in some of those remote and harsh areas.
Her father was really sick.
Indigenous Health Services told the Federal Minister in Alice Springs in August there was a national staffing and funding crisis. The Minister's office said it agreed to the immediate preparation of a national Indigenous health workforce plan. The health services are staying hopeful.
That we'd be able to identify all those gaps and persuade governments to fill those gaps.
Some remote residents like Davina Collins are hoping to start filling the gaps themselves. She's studying medicine.
I really would like to come back and start working in my clinic and start helping my people in my community.
In a community she loves, where more help is sorely needed. Jane Bardon, ABC News.